In this video, I'll talk about a couple different diagnoses so you have a better idea about how to approach them. Overall, these cases are pretty straightforward. By the time you're done reading the history, you'll have a pretty good idea about what's going on, or you'll have a pretty narrow differential at least. And then when you get your labs and imaging back, the program will tell you exactly what's going on. For example, you get a chest x-ray and it's tension pneumo, it'll tell you the interpretation. It's tension pneumothorax, and it's just testing to see, do you know how to handle this? So you'll do like needle decompression, for example, in a chest tube. Or like even with EKGs, it won't ask you to interpret an EKG. It'll just tell you like, oh, this is sinus tach, this is AFib or AFib, and you can go from there. Let's say a patient comes in with abdominal pain and a fever, so you're concerned about some sort of infection. From the last video, I would put in all my standard orders. I would put in like the culture of the blood, urine, and sputum for the fever. And then let's say I get a chest x-ray first, that's negative, and then I get a CT abdomen pelvis. This will tell me there's an abdominal abscess. So then I'll get a bacterial culture of the abscess, I'll get a Graham stain of the abscess. Then I can also do like a needle drainage of the abscess, which will help treat it. In addition, you'll want to start antibiotics. So two broad spectrum antibiotics that are great go-tos are piptazo and meropenem. So next, let's say a patient comes in with fatigue, cold intolerance, weight gain, trouble sleeping, loss of interest, increased appetite, constipation, and you have a mixed picture of like depression and hypothyroidism. In addition to my standard order set that already has TSH, I would also get a serum thyroxine. I would also add on a lipid profile, glucose, hemoglobin A1C. And let's say looking at the physical exam findings and your lab results, it confirms it's actually hypothyroidism. I would then start levothyroxine. The program will tell you if you're on the right track. So what I just mentioned should be enough for that type of case. And then it'll tell you like, oh, patient is feeling better, patient thanks you for your help, and it'll move you on to the 2-minute screen automatically. Let's say you, for any other case, you don't have the right diagnosis, you're not providing the right imaging or treatment, the case will tell you like, oh, the patient is getting worse. So then you know to kind of change up your plan. And then in the 2-minute screen, I would put in all of the standard orders for the preventative things, but specifically also make sure I put advice exercise for a hypothyroidism patient. So now let's say you have a postmenopausal female that comes in for weight loss, pelvic pain, and bleeding. So I would first start off with like a pelvic ultrasound. I would do a pap smear, and then let's say the ultrasound tells you that the endometrium is thickened. So the bleeding plus the thickness of the endometrium, you would definitely want to do a biopsy. So I would order a biopsy of the endometrium and also consult OBGYN. Let's say the biopsy comes back as cancer, then I would consult hemonc, I would consult radiation therapy, and also you want to counsel the patient on the cancer diagnosis. And then you'd also want to send them to surgery, so then I would put in the surgery order set. So those were just a few sample diagnoses and how I personally would work through them. The cases can be very simple and straightforward. Some can be a little bit more challenging. If you have any more questions or would like to work through any more diagnoses, you're more than welcome to email me or let me know in the comments what you would like to see more of. Thank you and good luck.